post regimen of nutrients. Most of our patients probably wouldn't need to be given any interval. They would do well without them. Most of them, 90% of them probably.
By simple eating?
By just simple eating or nothing at all. These very serious patients whom you need for proper treatment to compress, and most important, you need a mechanical decompression to prevent mechanical pressure on your anastomosis, which is probably more important than enteral depression.
I don't buy that. I buy that there is a need for decompression of the stomach. So I think eventually you need 2 tubes, one to decompress the stomach and one for feeding in the urine. I do not think that an anastomosis ruptures due to high pressure. I mean, there are surgeons who think that if they put an nasogastric tube into the stomach, the pressure will be relieved on the anastomosis in the colon 4 meters down. This is not so. I mean, this is a myth. And I do not think that pressure is an important factor behind rupture. It's a sort of mechanical thinking. I do think that the anastomosis, they rupture either due to infection, gangrene, and often due to the lack of nutrients, poor regeneration. So I think this is the area where we are going to see a new boom, as a matter of fact. But the concept you are explaining is that which has been accepted for long periods of time, but I'm challenging that.
Yes, Dr. Bang.
Do you think the enteral feeding with lactobacillus and fiber is useful to prevent the sepsis in burn patients?
Oh yes, I do. I am very convinced of that.
Have you got any experience?
I am very convinced of that, and you are going to see that.
Because in burn patients we are pouring millions and millions of gallons of antibiotics to prevent sepsis, which is which is the main factor for mortality nowadays.
Yeah. But studies by Wesley Alexander in Cincinnati support strongly that enteral nutrition increases the survival and reduces sepsis in burn patients. There are studies done for that. Wesley Alexander.
Any question? Yes, Professor.
Thank you, Stig, for a nice lecture, even for a non-aficionado. You brought up the skeletal system. I just want to make a brief comment. It's exactly the same. If we non-weight bear, if we non-ambulate the patient, they will have negative effects, side effects, in all tissues, in skeletal, in muscles, in joints, the cartilage. A fracture heals earlier if we can weight bear than non-weight bear. So enlarging your subject is relevant also for that.
Okay, thank you very much. Appreciate that.
Well, if there is no question, I got one more. Okay, thank you, Stig, for this evening, and I think we'll go for some dinner together.
So, the interest has been.
ما تعيشون؟ لا أنا ما أستيق الاجتماع مع الكل يوم عليك أقول
لأن أنا قلت لهم يا دكتور محمد يصير الرجسترار الرجسترار
الواحد يخش في أفاه.
Okay,